There is a new paradigm for combating cancer. The presence of anti-cancer immune cells, specifically cancer killer cells, is critical for effective treatment. Additionally, the more cancer killer cells that recognize different parts or antigens of the cancer, the more likely patients will experience tumor regression and possible cure. In some cases, the cancer killer cells can see the cancer, but not destroy it because of certain inhibitors, called checkpoints. New classes of drugs can block these inhibitors, essentially taking the brakes off the immune system and allowing it to destroy the cancer. Unfortunately, in most cases, these agents only work in a minority of patients whose immune system can already see their cancer. The remaining patients do not experience a positive response to these therapies. UbiVac DRibble Vaccine is a first-in-class technology that combines more than 100 cancer targets, including at least 13 NCI-prioritized cancer antigens, together with 5 immune stimulants, a spectrum of heat shock proteins and chaperones, all packaged in microvesicles that are targeted to dendritic cells, which can educate immune cells to recognize cancer. Studies in animals have demonstrated that DRibble vaccines were significantly more effective than gold standard cancer vaccines. Early studies suggest that UbiVac DRibble vaccine, DPV001, is effective at generating a broad spectrum of immunity against cancer targets. In current studies, DRibble vaccine is injected intranodally, with an ultrasound guiding the injection to a lymph node. Subsequent boosters are given intradermally. Molecules on the surface of dribbles target them to dendritic cells, delivering the dribble contents and activating these cells that can now educate immune cells in the lymph node to fight cancer. DRibble vaccines turn on 3 types of immune cells: B cells, CD4 helper cells, and CD8 killer T cells. All have the ability to mediate destruction of cancer. These immune cells then multiply, greatly expanding their numbers, and leave the lymph node to percolate through the tissues of the body in search of their target. CD4 cells make molecules that can have anti-cancer effects and serve a support function to CD8 cells by secreting growth factors to make them function better and for a longer time. CD8 cells, circulating throughout the body, are drawn to tumors, recognizing and destroying them. UbiVac DRibble vaccine educates immune cells to identify a large number of different cancer antigens, reducing the chance that cancers can escape detection. B cells travel to the bone marrow, where they make anti-cancer antibodies that circulate through the body, potentially binding the cancer and directly or indirectly having anti-cancer effects. Dribbles hold the promise of improving outcomes for patients with many types of cancer, as the vaccine contains more than 100 putative cancer antigens for patients with cancer of the lung, prostate, breast, pancreas, colon, or head and neck. Curing cancer, UbiVac's goal and everyone's dream.